If the blood pressure is 150, 160 on the systolic, and there is some cause for concern, so what might a person do? The doctor's going to prescribe certain drugs.
Yes.
But then there's also dietary supplements that could maybe be tried in addition to or in place of the pharmaceuticals.
Well, when it comes to the pharmaceuticals, be very cautious about going on what's called beta blockers. You know, a lot of doctors will prescribe beta blockers, and there are situations where they probably are the right way to go. But they're a very overprescribed medication, and there's very little evidence that they prevent heart attacks. And if your doctor does recommend a beta blocker and ask, is this a beta blocker, say, well, what's the logic behind that? And you might even say, I've heard there's some studies that show that these things don't really prevent heart attacks. Don't be afraid to challenge your doctor a little bit, because there's certain conditions you have where you may need a beta blocker, but a lot of times people get them as part of a normal blood pressure regimen, and they're more expensive, and they have very bad side effects. They tend to cause energy problems, and they mess with some things at a basic physiological level that you don't want to mess with. And diuretics, which are cheaper, older drugs, are actually shown to be more effective.
Oh.
So it's a great thing to ask a doctor, is this a beta blocker, does a diuretic make more sense? And if he recommends both, say, what's the beta blocker really giving me that the diuretic isn't? Now, when it comes to dietary supplements, there's a lot of ways to tackle blood pressure. One way is to go after stress. And anything that reduces stress can really help lower blood pressure levels. And there are some mineral-based and herbal-based and food-based supplements that can really be effective with stress. If you know that you have some issues with mood and with stress levels, it might really make sense to incorporate a mood-based supplement to help you kind of chill out. And that may actually help a great deal with your blood pressure levels. Inflammation and general stress on your system as a whole has a profound and indirect impact on blood pressure. So having inflamed arteries and having a body that's full of inflammation, it doesn't cause blood pressure to elevate directly, but it slowly causes blood pressure to elevate over time. Because cortisol levels increase, the resilience of your system as a whole begins to decrease, your physiological reserves begin to decrease. So tackling inflammation is fantastic, and of course we talk all the time about the fish oils. They really are one of the best things that people can do for inflammation. And then the other thing for blood pressure that most people probably wouldn't think about, but again, this can have a very profound and subtle effect, is actually doing some things to affect the health of the gut, to make your gut healthier to lower your blood pressure. Because your gut is your largest internal organ system. And when your gut is unhealthy, it taxes your body as a whole. It causes tremendous inflammation, and it elevates stress levels throughout your system. And whenever stress levels are elevated, physiological or psychological, it's going to result in an elevation of blood pressure over time. So gut health is fantastic, and we're actually going to do a whole mailer about gut health. But just as a beginning step, and I recommend this all the time, probiotics and digestive enzymes. Digestive enzymes taken at the end of a meal can really help your body process food more efficiently and reduce GI inflammation. And probiotics taken on an empty stomach first thing in the morning or at the night, they help balance out the gut by replenishing the healthy bacteria, and they really help lower inflammation levels. And a healthy gut improves the health of every organ system.
Good. Yeah, that's really great, because you kind of answered another thing, that people don't know how to take the probiotics and the digestive enzymes. So the key is to take the digestive enzyme during the meal, somewhere between the latter half of the meal, and the probiotics should be taken on an empty stomach.
That's my philosophy. Some people actually believe you take probiotics with food. I like them first thing in the morning on an empty stomach, or at night right before bed, because I don't want the stomach acids to kill the probiotics.
So we have two dietary supplements that are directly related to blood pressure. One's called Hyperlos, which is the 20-year-old herbal extract with the cinnamon and the google and about 20 different...
Which also regulate blood sugar, which is excellent.
Yeah, so the kind of the herbal spice combination that a lot of people have done well with. And then there's a new product called Oracine, which a lot of people have been writing in and testifying that they're getting great blood pressure readings.
Yeah, Oracine is a really interesting product. The preliminary clinical evidence that I've read on Oracine is fantastic. And it doesn't just affect blood pressure, it really kind of seems to benefit the full spectrum of cardiovascular health. It seems to kind of improve cardiac output, it seems to nourish heart muscle cells. And of course, the healthier the heart is in a bizarre way, the lower blood pressure tends to get, because the heart doesn't have to quite work as hard constantly to perfuse the rest of the body. So I think Oracine is a fantastic product. And the herbal-based stuff is great. But I always encourage people to look at herbal supplements as a complement to making healthy lifestyle changes, whereas it seems like Oracine is almost more of a nutrient. Like it's almost helping the body nourish itself and helping the heart be healthier at a fundamental level. So I'm a big fan of Oracine from what I've learned so far.
Great, excellent. Okay, the last thing on the blood pressure, I just wanted you to talk for a minute about aneurysms because, well, it's happened in my neighborhood where neighbors have suddenly come up with an aneurysm and it was due to high blood pressure. Can you explain
Partly.
the connection between those two?
So aneurysms can happen in the brain, they can happen in the body. And what an aneurysm is it's when the walls of a vessel grow very thin and near to bursting, and then they actually burst. And it causes internal hemorrhaging, and of course it's devastating to the system. I mean, very frequently it's a cause of mortality.
You got to be really close to a hospital.
Yes. You can get aortic aneurysms in the body, which is the major artery leading out from the heart, usually fatal. Aneurysms in the brain, they're terrible. And high blood pressure makes aneurysms far more likely. One, because high blood pressure chronically puts increased stress on vessel walls, and that stress does cause a weakening of the integrity of the walls. But then, of course, when blood pressure really spikes, you have this weakened vessel wall, and an increase in blood pressure causes an acute stressor into that wall and can actually cause the rupture. So blood pressure affects aneurysms there, and many people look at blood pressure like it's the big factor in aneurysms, and I actually think that the most neglected factor are the other things that influence vessel wall integrity. So the healthier your vessels are, the more your system can tolerate high blood pressure. And a lot of things contribute to healthy vessel walls. Low cholesterol contributes to healthy vessel walls. Reduced systemic inflammation contributes to healthy vessel walls. So everything good for your heart is good to prevent aneurysms. But one of the simplest and biggest things I think needs to receive more attention is vitamin C. Vitamin C really seems to improve the integrity of vessel walls. Andrew Weil talks about this a lot. And just having people on relatively high dose vitamin C, maybe a gram or two a day supplemented into the diet from something that has food source vitamin C, like packaged with rose hips, the odds are that people then survive heart attacks, or maybe it prevents aneurysms. And the evidence isn't really robust yet from a clinical standpoint, but it makes fundamental sense because vitamin C is a superstar antioxidant. So the idea is vitamin C may protect vessel walls from the damage that weakened them in the beginning and make them more resistant and resilient in the face of high blood pressure.
Right. So our daily minimum requirement for vitamin C from the scurvy viewpoint is 60 milligrams.
Yeah, it's absurd.
But taking 500 milligrams, 1,000 milligrams, one or two tablets a day makes a lot of sense.
It does make a lot of sense. I love what Linus Pauling said about the RDAs. He said the recommended daily allowances of vitamins are enough to keep you barely alive in ordinary poor health.
Right.
And I think that's pretty much spot on.
Yeah, so a gram or two a day makes a lot of sense. And
for so many reasons.
And
I take it too, and I don't really have.
We've been giving vitamin C away for over a year on our website for free, so there's no reason not to throw a bottle into your cart. Okay, well that's great. So we will continue with the next question in a minute.
Sure.